name is Jozelle Mator, and I work with the HOPE program at the Hamilton Health Center, located in Harrisburg, the capital city of Pennsylvania. The HOPE program is committed to providing the best care and the best services to HIV-infected individuals in the Harrisburg area. And our services include free and confidential HIV testing and counseling, medical care, dental services, transportation assistance, and so much more. Here at Hamilton Health Center, our HIV medical care is led by providers with extensive experience in dealing with real people and real issues. The HOPE program has an incredibly dedicated and committed team of professionals. They talk, they listen, and they care.
I'm Sarah D. Champlain. I'm the HOPE program director here at Hamilton Health Center, and I've been working with people living with HIV for over 11 years. Even though it's 2017, there's still a lot of stigma around HIV. Treatment has come such a long way since the beginning of the epidemic, but unfortunately people's mindsets haven't always come as far. Living with HIV can be really isolating. A lot of people are scared that there's not anyone in their life or their communities that will understand what they're going through. People worry that they might be judged or that people will treat them differently. A lot of the stigma around HIV comes from a lack of knowledge. A lot of people think that they're not at risk for HIV or it could never affect them or their life. But anyone's at risk for HIV, and it could affect any one of us. It might be your coworker, your neighbor, your pastor, your friends, or your family. Anyone can be at risk for HIV. Providing education and openly discussing HIV in our communities is so important in helping to fight stigma. It's important for people to learn what HIV is, how it's transmitted, how it's not transmitted, and what it's really like living with the disease. If people can connect with an individual person's story, they really learn a lot more, and it can go a long way in fighting stigma.
My name is Deanna Reeves. I'm the medical case manager here at Hamilton Health Center with the HOPE program. As a medical case manager, what I try to do is assist patients with housing, employment, transportation, and also food. Any needs that they may have medically, I can be the contact person for the patients and for the providers. So just making that connection between patient and any services that they may need, community or medical. Another service that we provide is that we're able to purchase 11 ride bus passes for patients, meaning they can have 11 rides within a month. Whether they need to get to their medical appointments, whether they need to do things in the community, we do have that assistance for our patients. One barrier I do see is that some of the transportation assistance that we do have that maybe through medical assistance, the transportation is only for medical appointments only. So which works for some clients. Other clients may have some other needs that they need to take care of, and transportation could be an issue in that way. So we have established a contract with a local cab company to assist patients with not only their medical needs, but also maybe things in the community that they may need to get to, sort of like on an emergency type basis. I find that patients do need, well, some patients need reminders, whether it's like a robocall or just a quick phone call to say, hey, your appointment's at this time, this date, remember to come in, remember to get your meds, get your lab work done. So some clients, not all, but some clients do need that extra push sometimes to get in here for their appointments.
According to cdc.gov, in 2015, an estimated 1,170 adults and adolescents were diagnosed with HIV in Pennsylvania. Pennsylvania ranked 10th among the 50 states in the number of HIV diagnoses in 2015. Estimated adults and adolescents diagnosed with HIV by transmission in Pennsylvania 2015 is as follows. 2.5% men who sleep with men and injection drug users, 7% injection drug users, 33.7% heterosexuals, and 56.8% men who sleep with men. The estimated adults and adolescents diagnosed with HIV by race and ethnicity in Pennsylvania 2015 is as follows. 1.3% multi-race, 1.8% Asian, 13.4% Hispanic Latino, 29.7% white, and 53.6% Black.
I'm Jacqueline Bryzak. I'm a family nurse practitioner, and I serve people of all ages here, and I'm also one of the providers with the HIV program here at Hamilton Health Center, the HOPE program. The HOPE program at Hamilton Health Center is very important for our patients because it provides an extra level of robust and complex patient care to many of our patients who need it. Unfortunately, people living with HIV still face a number of barriers. That can be related to their socioeconomic situation. It can also be related to some of the stigma that unfortunately still affects people living with HIV. Our program provides for clinical support as well as social work support. So some people may need help with transportation, they may need help accessing behavioral health care, or just a little bit of assistance getting their medicines and making sure that their medicines are affordable. The folks working with our program are dedicated to helping people not just live with HIV, but to thrive with HIV. So people living with HIV unfortunately can face a number of barriers to care. Some of those barriers to care can be external and broad, from difficulty with housing, difficulty finding appropriate transportation to get to their work, to their healthcare provider's office, to some barriers can be interpersonal, finding family members and friends whom they can lean on when they're having difficulty working through their diagnosis. And even then, some barriers to care can be more internal. Some patients have told me that when they take their medicines, it reminds them that they have a health problem, or it makes them feel like there might be something wrong with them. And so we work with patients to help them address these barriers, from social work to help them get to clinic, to help them stay in good housing, help them work through issues with their families, and then hopefully working with patients to change that mindset from the stigma of taking medicines to taking your medicines feeling empowering, that you're saying, I'm taking care of myself and I'm going to do well despite my diagnosis.
Now, I was raised right here in Pennsylvania, but I was born in Liberia, West Africa. On one of my most recent vacations back to Liberia, what first started out as curiosity turned into opportunity to find out where Liberia stands in the fight against HIV and AIDS when it comes to prevention, testing and treatment procedures, counseling, improvements, and barriers. Let's take a look back at my journey. Liberia, officially the Republic of Liberia, is a country on the West African coast. The country's capital and largest city is Monrovia. Liberia is mostly inhabited by indigenous Africans but was founded by free black slaves. Liberia is the first African republic to proclaim its independence on July 26, 1847. The Liberian flag bears a close resemblance to the flag of the United States, showing the freed American and ex-Caribbean slaves' offspring and bloodline origins of the country. Liberia is Africa's first and oldest modern republic. Known in the 1900s for its long-running 14-year civil war, around 250,000 people were killed in Liberia's civil war, and many thousand more fled the fighting. It's been nothing short of an uphill battle for Liberia to rebuild itself, and though Liberians are extremely resilient, the absolute destruction of the country left many areas of Liberia far from up to par and in great need. Though it has come a long way, healthcare in Liberia is an area that still struggles. So it's no surprise that HIV is a virus that is still prevalent and needs awareness, prevention, and treatment. According to UNAIDS.org. In 2016, Liberia had 2,900 new HIV infections and 2,800 AIDS-related deaths. there were 43,000 people living with HIV in 2016, among whom 19% were accessing antiretroviral therapy. Among pregnant women living with HIV, 70% were accessing treatment or prophylaxis to prevent transmission of HIV to their children. Among people living with HIV, approximately 13% had suppressed viral loads. One of the key populations most affected by HIV in Liberia are gay men and other men who have sex with men, with an HIV prevalence of 19.8%, and people who inject drugs with an HIV prevalence of 3.9%. Since 2010, new HIV infections have decreased by 28%, and AIDS-related deaths have increased by 20%. The Ebola virus disease outbreak in March 2014 further weakened the health system as health workers died and access to HIV services reduced by 50% in 2015.
I am so excited for today because some of you may know I work in the field of social media and outreach at a health clinic called Hamilton Health Center in Harrisburg, Pennsylvania. We deal with health and wellness as well as HIV and AIDS in the department that I work in. So I have the opportunity today while I'm in Liberia to talk to some nurses and doctors from various hospitals within Liberia about where Liberia stands in health and wellness and in HIV and AIDS. How far we've come, how far we still need to go. And
my first stop was at the Hope for Women International Health Center. The Hope for Women International Health Center is a Liberia-based, non-governmental organization established in 2010. It grew out of the experience and concern of a few medical personnel who saw both the lack of hope and lack of options for women diagnosed with cervical cancer. I had the opportunity to sit down with Dr. Wilhelmina Jozelle and midwife Sarah Artis as they shared with me how they work with their HIV-positive patients.
Good evening, I'm Dr. Wilhelmina Jozelle, the Medical Director of Hope for Women International in Liberia, Monrovia, Liberia. This institution has been around for about 4 years, and one of our main focus here is on women. So we deal with women from pregnancy to cancer, so all along the continuum. We have a lot of women with infertility problems, or we have women with cancer, we have women with breast and cervical cancer. We see women with just the everyday problems of life, or from husband's problem to children problem. So we kind of try to talk to all of them or through all some of these problems. One of the women that we do see here are women that have HIV, whether they are pregnant or they are not pregnant. A lot of women, they do not like to go to the general hospital because it's not too personalized. So they like to be dealt with in a private setting where nobody knows them. And so they can have the level of confidentiality that they want. And so we try, and the challenge for those kind of women is we have to get the medications and bring it into the center, and so that we can be able to serve them on that private level. Everything is still free, or the testing, the counseling, or some of them already know that they are positive, and so they will travel all around, and finally they will end up in a private setting, you know, hoping that nobody will be able to recognize them. The challenges is just them keeping up with their medications, and taking it, or even taking it properly. One of the problems that I have observed with women who are a little bit older, women 50, 60, when they come into the center, or after, you know, one of the symptoms that they will usually present with will be or fever that not getting better with all the different medication. A lot of them say, oh, I've been treated for typhoid, I've taken 15 or 20 drips. And those kind of women, when they present with that kind of symptom, one of the things that come to our mind is that we need to do the HIV status. And when you do the HIV status, you find out they are pregnant. And at those ages, when you tell them that they are positive, they give up. You know, because they kind of have a feeling of where they have come from. Most likely it's a promiscuous husband, or that they have caught it from. So most of them, I have seen most of them that died because they refuse to take the medication. They even refuse to accept the fact that they are positive. So it gives them a hard time. And so we try to encourage them, but a lot of them gave up hope completely. One of the things that we do in the center is to try to prevent maternal and child transmission. And one of our nurse, Sarah, she's one of the best person that you will get the most information from on how we try to help these mothers to prevent their babies from getting from becoming HIV positive. A lot of things that we have to do to prepare the mother, and after the delivery, what we have to do, and Sarah will be able to tell you a little bit more on that issue.
Right. I'm Sarah Artis, a midwife at Hope for Women International, where I take care of positive women. I have been care and treatment for a long time with these women. For the onset, what the major problem we have is disclosure. When these women are positive, coming to tell their partner is difficult. Up to present, some of them have had 2 to 3 children, and the husband don't know their status. So from the beginning, what we do, we go for general counseling, do the general test in the morning. Later on, once you are picked up positive, we call you one by one, and we talk to you that you are positive. If you are willing to get on board, we start with the treatment. But most of the time, if some of these women are positive, to get them on a program is a bit difficult. They will tell you are not presenting a sign and symptom, so they will not want to believe what they are saying, but you have to keep talking to them. Later on, they can come on board.
My next stop was the Firestone Medical Center. The Firestone Medical Center, formerly known as Dusad Hospital, is a 300-bed hospital. It has 8 additional health facilities and a mobile clinic. The hospital treats an average of 5,700 patients each month. Along with its many services, the Firestone Medical Center works with the Liberian Ministry of Health to control HIV, AIDS, tuberculosis, and malaria. I had the opportunity to talk with Reverend Salome Vangpana, the coordinator of the HIV department, about their HIV testing procedure, areas they are doing well in, as well as areas that are in need of improvement. I also had the opportunity to talk with an incredibly knowledgeable, honest, and transparent group of men and women who agreed not only to have our group discussion recorded and used for this film, but shared as much as they could with the purpose of helping to spread awareness.
Yanga Vakmana, work for Firestone, and I'm the focus person for HIV in the medical center.
What's the process for HIV testing and treatment here at Firestone?
Okay, people who come in, sometimes we go to OPD and we give the word on HIV, and then people come out. So those are voluntary people that come and we test them. But there are others who will also come, who will walk in from other facilities, or people bring them in by referral, or sometimes from the ward where the doctors will want them to be tested. So we take them in and we do their tests. But before doing their tests, we do counseling, and where we are able to tell them all about HIV, we give them information. And we are able also to not only give the information, but dig out the risks, benefit, give it to them. We also do prepare them, their mind. So the psychological part is done, and that person is willing to say, okay, I've gotten information, so let me just walk and do my test. So after giving them the word and encouraging them or giving them information, we go in and we do the test. And that is also done here in the next room. And we go there, we do the test, and then we come for post-testing. counseling, where we also say to them their test result. And then we recap those things that were said in the pre-test counseling, but we want to be short. And we don't go very long because the person wants their result. They are anxious. And so we give them their result.
You can just handle somebody with HIV.
Yes,
yes.
I get it.
You know? And it took us a while. We don't know how far you guys are now. You see what I'm saying? We're all still trying to get better on that side. That's why they're so important for what she does. Because we still got to educate. She still has to educate people to say that it's okay, you know.
It's very difficult to bear with. But now where you have found yourself, you have to live with it. And the only thing to do is just be on your medication on time and at the right time. Do your medication correctly. And eat the nourishing food that will make you to live. Because your life now depends on the tablet. And we are living. See, where you see yourself and you are living, yeah, tell God thank you, and do what they tell you to do. And our mother can really help us. She can advise us and tell us what to do.
As for me, it was not a easy task for me. Well, I got 2 children when I got in the private. But it encouraged me from our mother. The stigma was not easy. For myself, me, my very self was not even free. When they pronounce that positive, my children, the struggle, I will not choose it. But the encouragement from our mom, the half, I say I've been free. Getting it, to encourage her, and more especially me. I stubborn. I got too stubborn. The children business, they left on the children too, but the place of her they are free. Yeah. But the encouragement from her, that's the
job. And you carry yourself back home. Now, you want to kill yourself. So long you accept it, you got to continue with it.
What are some of the things that happen to you? All live with the mind and the counselor and yourself. One of the best things to become an HIV positive, to stay alive, is our HIV positive have to click to our HIV positive. Because if you in a relationship with HIV positive, then 2 of you can live. Because when you will remind me to take my medicine, and I will remind you to take your medicine. But if you are HIV positive, then you follow somebody who is not HIV positive, you can live a difficult life. I was 28 years old when I got to know that I was HIV positive. I got very sick. But I have few people that got to know that I was HIV positive. But one stayed by me, all fell aside. It was very difficult for me.
For me, it is not easy to live as an HIV positive person. It is only by the education the counselor gave you. And I also went for counselor training. Although there is no job for someone or we're not working, but we maintain our job and we pray and we IC that our job will come in.
Liberia receive this information along with HIV into the country. The message that came with it: if you get HIV, you will die. Your family will get it, your children will get it, and you will die. And so people hold on to that. And since it grabs that, it is a tough thing for us to do. They're getting that statement out of their mind to break that difficult thing. Yeah, so it's making the whole work difficult for us. Yeah. So if you like break word to somebody, according to the test result, you are positive. The first thing that runs to the person's mind is committing suicide. Yeah. And you the counselor has to be there to talk. You gotta make sure the person is calm before you can take further steps, even with the medication or other things.
Go out there and get people who still got a little problem with, not little, say got problem with stigma, like he was talking to you. We need to get out there and give the word. Tell people HIV, you can stay with people like our poster here in the back. You cannot get HIV, but I really love this one. Yeah, so it would tell us how we can get HIV. So people like, so when you church and you don't get it, and all that. Some people say, we went somewhere one time to give the HIV word or to give a witness, and the guy said to me, I said, how do you get HIV? Raise a hand. And your people said to me, we get HIV by talking. And I was like, I took it over from right there because people were passing by. So I had to come in to correct him and started to give how HIV is got. So stigma is around. We have less support right now on prevention, getting out there to inform people. Somebody will start and somebody will not push them. You will have the team of people wishing to go, but you don't have the support to get in there. So those kind of things. Medications, thank God, is free for now. People have to just walk in. But then again, getting them to come to the facility, no transportation.
From HIV medication being reduced to just 1 pill a day in many places, and new medications such as PrEP that help those who are at high risk for HIV lower their chances of getting infected. The encouragement of condom usage and the increase in individuals is taking the necessary precautions and also getting tested is proof that the labor is not in vain. It's evident that Liberia is working effortlessly to rebuild, especially in the areas of healthcare, but it's still an uphill battle. They're still in dire need of assistance when it comes to things like supplies and the many services that their HIV positive patients being treated at their facilities need in order to continue to remain healthy and strong. Two of the greatest similarities that I noticed both South Central Pennsylvania and Liberia, West Africa, still battle is getting their HIV positive patients to remain on their medications and to stay in consistent communication with their healthcare providers, as well as the stigma that still lingers. That simply means that there's still more work to be done. We can all play a part in the fight against HIV, including just to help spread the awareness of it, which will help these organizations and facilities play their role in helping to stop the spread of HIV, as well as keeping their patients who are affected and infected by HIV happy, healthy, and well.